Well, good morning, everybody. Thanks for joining us. As some of you may know, I'm Tony from Mercy Perrysburg Family Medicine. And as we do the third Wednesday of each month, give a talk on a different medical topic. Today, we have Shannon, who's one of our pharmacy students that's joining us for the month at our program. And she's going to talk about pain control. Certainly, as we get older, we start to notice a little bit more of aches and pains. And what might be my pain tolerance for certain things might be different from yours, but she just has a good overview of describing what pain is. And I think that the two take-home messages is how to best work with your healthcare provider to address your pain so that things are properly taken care of. And then the second thing is, what can I take or what should I be avoiding when it comes to pain in relation to the other medicines that I'm on or my allergies and things like that. So I'm going to turn it over to her and then we'll stick around in case you have any personal questions.
All right, so let's talk about pain. I know you mentioned you got a lot of pain as you've been getting older. So like Tony mentioned, a lot of us live with pain. About more than 50% of people over 65 years old are dealing with pain on the daily. And a lot of people also deal with chronic pain. So you don't have to just live with your pain. And that's one thing I really want to stress today, because some people may think like, I have this pain, nothing's going to make it better, but we don't have to live that way. And if it's affecting your quality of life, that's a big reason to try and get things taken care of. So first I want to talk about the two different types of pain. So you have nociceptive pain and you have neuropathic pain. So with nociceptive pain, that's more so if you have an injury. Like if I was to bump my elbow in here, that would feel awful. That would be an injury. And so that one is considered kind of acute. And it can be considered chronic when you have things like arthritis. But for neuropathic pain, that's more so with your nerves. So a common disease is patients with diabetes experience neuropathic pain. So they have the tingling sensation and, sometimes numbness. And it's important to know if you're experiencing neuropathic pain, because it can also be a side effect of certain medications. So if you ever start a new medication or notice some changes like that, definitely want to let your doctor know, because we could stop that from happening and it's a better treatment option for whatever the issue is. We definitely want to do with that and not cause more issues. So one of the best ways when you're talking about pain is the 7 steps on that paper there, because we want to make sure that when discussing pain that you include as many details as possible, because that's going to help guide like what's the best step to treatment. So you always want to know, when did the pain start and where is it? Location is important because, that could lead to like, okay, is this an injury from a possible disease state, or like, did you get hurt? We want to know things like that. And when did it start? Because we want to know, like, have you been doing this for weeks, months, days? Because, that can also affect things. And then with how severe it is, we always like to use a pain scale, 0 being no pain, 10 being the absolute worst pain you could think of, like how. That's how I like to think of it, because if my pain is under 10 and I'm this person child labor, no, we need to handle this. And I like to use that pain scale because the way that I rate pain may not be the way that any of the other people may rate pain. So what may be a 10 for me could be a 5 for someone else. And I mean, because of that, it's important when knowing like how should we treat it. Because some people can live with a pain of 3 and they'll be perfectly fine. And if it gets to like a 6 or a 7, that's where it's like, okay, no, I got to do something about it. So we have to know like what area are you okay with it? Because with some pain conditions, you may not get to a 0. And that may seem unfortunate, but as long as you're at a level where it's not affecting your quality of life, it's not causing you to not be able to get up and move around and things like that, then I mean, sometimes we do have to deal with that. But we want it to be as best as possible where it's not, going to affect the quality of life. We also want you to describe the pain's character. So like, is it sharp pain? Is it like stabbing pain? Is it that burning feeling? And we want to know, does it go anywhere? So a lot of people like to say, like, does it radiate? Meaning it started in my shoulder, but now I can feel it moving down all the way to my elbow. Because that could be a sign of something serious. You know, it's one thing for it to just be in that one area, but if it's starting to spread, that's going to lead to more issues. So it's important that you always let the doctor know, like, no, it's spreading everywhere. Like, we need to handle this. And then we want to know, how often does it happen and how long does it last? Is it something that just lingers on, like it never goes away? I just have this constant pain and sensation. Or is it something where it's like, when I'm sitting down, I'm fine, but once I start moving, absolutely not. That's when the pain comes. And then what makes it better? What makes it worse? Sometimes, like I said, with the sitting, like if I'm resting, I'm good. But once I start walking, that's when it gets absolutely horrible. And what have you done to like try and treat it on your own already? And that's important because if you say, like, if you don't tell your doctor that you've been doing an ibuprofen, and then they're like, okay, I want you to take ibuprofen, you're gonna be like, I've been taking it and it's not working. So we always want to know what you try so you could try something else. We don't want to keep doing the same thing if it's not working, because that's not going to be beneficial for anyone in a situation like that. So, like I said, you want to work together as a team with your doctor. So if you're having these issues, you know, you want to come prepared with the way that we just described in different ways, you know, to discuss the pain. Some people even recommend keeping a journal. So you can keep track of how things were. Like, okay, today it wasn't as bad as yesterday. Because I mean, if you've been dealing with something for like 2 to 4 weeks, you may not remember exactly how it was, but at least if you were writing things down, that could give everyone a good picture. Like, okay, maybe it's not as persistent as I thought, or maybe it is more persistent than I'm probably describing it to you right now because I'm in so much pain. Because I mean, when you're in pain, it can affect how you think too. It's like, nope, I need it over. We got to do something about this. So you also want to try to keep moving, keep busy, and exercise. And I know sometimes that can be difficult when you're in pain. Like if I tell you that walking makes it worse, I don't want to walk. But sometimes we do have to keep moving to get that stiffness out. And sometimes that can help whatever injuries that you may be dealing with. And then big one that's important, always keep a list of your medications. Because different treatment options for pain has different interactions with certain medications. And the last thing you want to do is make that worse. Like if you have different medications that are making whatever illnesses you're dealing with well under control, you definitely don't want to mess that up and cause, you know, greater issues. And a lot of people don't think about this, but if you take like vitamins or supplements, you want to write those down too. Because a lot of people think with supplements, because they're natural, they don't consider it medicine. But it is. And it can cause its own interactions with things. So we just want to make sure we have a complete picture of everything that you're using right now. So always keep that in mind with the supplements and the vitamins. And then make sure you keep your follow-up appointments. Because the purpose of the follow-up appointment is to see, like, is what we're doing working? Or do you feel the same, or is it getting worse? Because if you're feeling about the same despite the treatment, we don't want you to continue to feel that way. You know, the goal is for you to feel better, and that's the way you can take control in doing it. Now I want to talk about the different medications. Can I get a water out of there, please? Got a tickle one. So there are so many different medications over the counter. Like when you go to the drugstores these days, it's just everything. And then you see like the different brands. You have Tylenol, Motrin, Advil, Elite. So depending on the type of pain that you have, that's gonna be the best way to decide. Like if you're taking something over the counter, what is the best option for me? So I like to start with NSAIDs, like the ibuprofen. I feel like that's one of the most common things is ibuprofen. And that one is important because it can really help with inflammation or swelling. So if you're having like some swelling going on, you kind of want to avoid Tylenol because Tylenol doesn't really help with swelling. So you got to think about those things when doing that. But you also have to consider like what other issues you've had in the past. You don't want to take too much of these medications because that could lead to more issues. Like some people who have issues like with their kidneys, they may not be functioning as good as they used to. You don't want to take too many NSAIDs because it can make that work. Or if you've had like ulcers in the past or some type of bleeding incident, ibuprofen, like NSAIDs, those can also make those worse if you're taking it long term. Now, if you're taking it just for a short amount of time, then it's not that bad, but it's always something to be mindful of. And then with Tylenol or acetaminophen, if you have issues with your liver, that can interact with that. And sometimes it may make that worse. So you always want to keep that in mind. And then you have like the topical agents, like lidocaine, capsaicin, and menthol. So I got a question for you guys. You got to participate. Out of these three, can you guess which one's main ingredient is chili peppers? Yes. I always like to point that out. Because whenever you use creams like that, you have to wash your hands afterwards, especially with capsaicin, because of those chili peppers. A lot of times we rub things on, and then we get to touch our face, rub in our eyes.
Yeah.
Can you imagine chili peppers in your eyes? Oh my goodness, that would be
Nose.
terrible. Yes. I always like to point that out. And then another thing, when we talked about the different types of pain, like the trauma versus nerve pain, if it's more nerve pain, those topical numbing medicines are most effective with that versus trying to take a pill. Because it's like your nerves. So if you put something on it, you know, that's going to be more beneficial for you. And then you have to keep in mind, sometimes these things take time. A lot of us get impatient when we're in pain, like we want the pain to stop. But when you take things like with the NSAIDs, have you ever heard of Voltaren?
No.
That's a common one. But Voltaren doesn't work immediately. It's a topical NSAID. And so for some people, it could take up to a week to start feeling some type of effect. So you want to keep that in mind too, because if you need immediate relief, you want to make sure that you're taking something that's going to provide that immediate relief.
I use that.
Don't Voltaren?
Yeah.
Okay. Oh my goodness, thank you so much. And I love Ricola.
They're all that.
Another thing I like to point out, so many over-the-counter products are combination products. So we can't always just say, I'm going to get Tylenol or I'm going to get ibuprofen. I'm going to get lidocaine. It's like, which one? Even let's start with Tylenol. You have regular Tylenol, extra strength Tylenol, Tylenol arthritis, Tylenol PM. Which one of those do you think has a combination product?
Definitely the PM.
Right. Because it's trying to help you sleep. So that's gonna have Tylenol and I believe the other component is like Benadryl. And some people don't think of that. And with those, so you got the Tylenol regular strength, that's 325 milligrams. The extra strength is like 500. And arthritis, I believe, is 650.
Wow.
Right. So you want to keep that in mind and making sure that you're getting the right amount, because if you don't know, then you could be taking too much. And that could be, which you don't want. Some alternative not medications, methods is doing like hot cold packs, massage therapy. Some people may feel like I take enough medications, I'm not trying to add on. And then you have some people who are really just against taking medications, and that's fine too. So like, it's an acronym that we like to use, it's called RICE. It's RICE therapy. So like say, if you strain your arm from like overstretching it, you pulled the muscle, you slept the wrong way. Or if you like sprained your ankle or something. Sometimes things like that don't need medication. You just need rice. So you rest, you ice it, you apply like a compression, like an ace bandage or a brace, and you elevate. Because the big thing with that, you just want to let it get time to heal itself. Sometimes we don't need medication. We just got to pull back so the body can do what it knows how to do with those injuries. So always keep that in mind too, because that's always a great thing. And then another one I like to point out is aqua therapy, because I feel like it's very unique. So I have a friend and she has MS, deals with a lot of pain. But being in the water, exercising, has been so beneficial. And a lot of us don't always consider it. This cough is killing you guys. I'm so sorry. So there are so many different ways to approach pain. So the biggest things I want you to take away. You rest. Try and get single products, not combination. Keep a list of the things that you're doing. Know how to describe it. And know that you play a big role in making sure that things get better. You always have to advocate for yourself. And that's a big one too. You guys have any questions?
On the list of medications, you didn't add or say anything about aspirin. Do you feel it's beneficial to take that? And if so, when?
It is beneficial. It's just not one that